Hi, welcome to another edition of eCW Podcast. I'm Brian Saul, and today we're in Carson City, Nevada at Carson Medical Group. Joining me today are Maurice Sanders and Janet Turner. Hi, guys.
Hello.
Thanks so much for spending your time with us this morning. Really appreciate it.
No problem. Thanks for
Today
having us.
we're going to be talking about patient engagement, really kind of focusing on three different areas. We'll be talking a little bit about the patient portal, a little bit about Messenger, and a little bit about healow. But first things first, you guys have been using eCW since 2007, is that correct?
That's correct.
Late of 7, yeah. November of 7, yeah.
And you began using the portal in 2011, is that correct? Why did you decide to bring the portal up and live?
Well, for us, it was mostly because of meaningful use, the government incentive program. We needed it. We didn't realize what it could offer our patients at that time. It was a have to. It didn't take us long to realize it would be, good for the patients to actually utilize the portal. So we did it as a have to, and then ended up being something really exciting for us. So,
was it a quick implementation?
No. We rolled it out with our family practice. We're multi-specialty, so we have specialists and primary caregivers. Family practices are kind of our pilot place. We do everything first there because they're the easiest sort of to get along with. So we started it there, rolled it out, started getting some email addresses, and then I don't think it took us very long, maybe within 4 to 6 months. I can't quite recall. We had it everywhere. The
4 to
staff
6 months,
department.
really,
Yeah.
Across all your offices.
Yes.
That's fantastic.
Yes.
It was it was rough in the beginning.
To use
I was
it.
And to learn, for me, to learn it, I was told, well, why don't we start and you can let people know what this is all, let the employees know what this is all about. And I can remember saying, I don't even know what it's all about. So learning it and then trying to spread it to all the departments and all the employees, for me was a little tough because it really was just kind of trial and error. It really was just, I'm going to get on it and play with it, and I'm going to see what it does, and then I can share the good news.
Well, that's an interesting point because, as you said, you originally started out thinking, well, we're going to use this for meaningful use. Yeah. But then as time goes on, you find yourself expanding it and using it for these additional purposes. Yeah. And that's when it really becomes that much more of a powerful instrument at that point. Right. Staff training, you did all the training yourselves for the staff?
Yes.
We did.
Yes. We didn't use eClinicalWorks for any marketing material. We made our own. We didn't use it for any training. I'm not sure it was even really offered at the time. We didn't have a good relationship with eClinicalWorks back in 2011 compared to what we have today. So we didn't realize the resources available from eClinicalWorks.
We didn't know how much we could reach out to. I mean, I don't know why it never dawned on me to think, well, let's call eClinical and see what we're supposed to, but it just didn't.
Yes. And the customer service for eClinical's come a long way since 9 and 10.
Your providers, how anxious were they to bring this up and running?
Oh, they were on board? No.
No, not.
No. I will tell you, they took a lot of convincing. Back in 11, their biggest fear was, this is my record. And I don't want my patient to see what I'm writing. And there was a few ways around that. One, we took actual screenshots of what their progress note looked like compared to what the patient saw in a visit summary on the portal, and how we could control some of those things that are there. Lab results were an issue for us. Originally, we would have the docs publish every lab they wanted as opposed to having it automatically go because they were so afraid a patient would see the results and call before they had a chance to, talk to the patient or decide what they were going to do, or they would get these bad results. As the functionality of eClinical got better over time, we can control some of those, the HIV publications. There's certain labs we don't publish at all. But now they're so much more comfortable. Everything is published to the portal automatically as opposed to how it used to be. But they were afraid of the patient calling them on something. Hey, you said I was rotund in the note.
Right.
What the docs, I think, It took some convincing, saying they could get these records at any time thanks to HIPAA. These are the patient's records. They are not your records. That took a little mind shift, not too hard. But getting them comfortable, showing them what the patient sees is very limited back in 2011, what the patient could see on the portal.
Right.
And the functionality of the patient portal then was pretty limited. So they got on board. One of our seniors,
along with that, no, it's okay. Along with that, what's been nice is, I think, because it has come so far, I think us starting when we did was actually good, because it was limited, and our providers have grown as the portal has grown.
Yes.
So for them, if we would have started now and said, well, we can publish all this and this is what they can see, I think they would have been twice as scared. They were already very hesitant.
Yeah.
So I think it's been nice that we started when we did, and they've grown
right
and adapted it as
the functions
have changed,
have gotten more robust. But again, on the back end of it, you still have a lot of control. You could still not publish certain lab results. You could still, we have pediatric practice here, so now having some more settings to manage proxies and those things that will come much more into play. Part of the problem was if you had mom and dad and they both had the email address, and then they got a divorce and dad didn't have custody, and there was all that stuff from pediatrics that comes along with family dynamics. So some of those things we had to worry about then. Peds was always a low adopter for us, pediatrics. So that helps us to push it more in pediatrics, to say use the portal. The major attraction for pediatrics was the immunizations. You can get your immunizations on there.
Yeah. Have instant access to that's great.
But other than that, moms generally don't like to email if they're worried about their child, I think. So it's a call. But as time goes on and that has changed, and you have more access on your phone, or you can request appointments and those kind of things, it makes it more useful. But I think pediatrics is still our lowest adopter of the portal.
Now, once you got the docs and the providers on board, what did you do to get to bring patients on board, so to speak, to encourage them to use the portal?
I think, not just the providers, but you really have to get the entire clinical staff on board, because no matter how much the front office talks about how great it is and really tries to introduce it to the patients, they're going to listen to only so much. And then the next point of contact would be the nurse or the MA. And if you can get the nurse or the MA to get on board to even just mention it, did they talk to you about the portal? Because this is something that we're doing, and it's a great, we're moving that way. And if they could just mention it and then have it backed up by the provider is huge. Yeah. That is huge. That takes an act of God. You really, to get these people really engaged, and you just want to say, please just help us with this. As soon as they do, you can't believe how the patients react, especially to a provider.
Yes, so
they're very positive.
If your provider is enrolled, is an advocate for the portal, which we have several in our practice, it makes a big difference. You see the difference in your numbers. If your MA uses it, we've said, use it like a vital sign. When you check your patient in, say, hey, are you on the portal? Are you web enabled? Different verbiage. If you're on the portal, that's how we're going to send you your records, your lab results. If for the front office, we have a huge practice that has long hold times. So every time the patients call in, the nice thing for Janet and I, who handle those complaints sometimes, is we can now say, oh, you don't like our hold times? Use the web.
Have you been told about the portal?
You can send us a message, and it comes right in, and you never have to talk to the front desk. You never have to be on hold 3 times or for 20 minutes. So that at least gave us those options. But really for the patients to be involved, the docs, the people in the back have to be engaged.
Right.
If they're not engaged, it just is less. There's less weight to it when you say, "Hey, make sure you send me the message," or I'm going to publish your labs. When your labs come in, if you have any questions on them, send me the message and I'll get right back to you. Those are things that the docs are able to say right in the room, right with the patient, and then they take it seriously, as opposed to the front office. They just seem to.
True.
It's another paperwork. It's another thing to do. It's another. Yep. Thanks. I'm waiting to see the doc. So.
when I was the first portal ambassador, as we call it now, I will tell you there were times that I would get on the phone with a patient, and generally it was, maybe somebody that was a little older, that literally I can remember one of our patients was like, "Hi, good morning, Janet. I'm calling to have coffee with you. Do you have your coffee? Because now I have another portal question." And literally we developed a relationship on the phone via the portal, and finally he came in and said, "I just need to meet you in person because I have coffee with you 2 or 3 mornings, 2 or 3 mornings a week." And I took that example and tried to give it to the front office, like, this is a great way to also build a relationship with our patients. We're not forcing them. We don't want to pull their teeth. That's not what we want to do.
Yeah.
But we do want to show them a way to communicate better with us without the hold times, without the frustration, This, of course, as it grows, when you first start out, it is a little frustrating for the patient learning it, but it doesn't take much to get them. If you can just kind of capture their attention and be excited about it, then I think that really makes all the difference.
Have you been to an eClinicalWorks Days event? If not, you're in luck. During 2016, the eClinicalWorks Days team will be visiting 64 cities across the country. Each event offers a main classroom agenda as well as other specialized sessions to provide you with a whole day of learning. And if hands-on is more your learning style, we offer 20-minute one-on-one sessions with specialists from our EMR, billing, and EBO teams. And it's all available at no cost to you. If you're interested in attending one of these events or want to see when we'll be in a city near you, please go to www.eclinicalworks.com/eClinicalWorksDay. We hope to see you there.
One of the things that we found with our clients is that for adoption purposes is using the eCW Ask Me About the Patient portal pins, which if you're interested, please give your Sam a call. We can get those out to you very, very quickly. You guys, however, took a kind of a little bit of a different approach. Very novel, pretty unique, and apparently really successful. I love this idea. Can you tell us about it?
Yeah.
We decided to do a campaign, portal campaign.
Yeah.
And we would brainstorm. We would have these meetings and brainstorm and say, what are we going to do? How is this going to be any different than what we've done in the past?
13, 14?
October of 14.
So we'd been on it for some time and had stagnant numbers and needed to make the next push. Meaningful Use 2 was coming and said your patients must contact you through the portal, and that was a big worry for most providers. So that's why we started to say, how can we get our patients to contact us more? If we have to meet these thresholds, some docs are fine, but some docs don't use the portal hardly at all. We need to make it exciting. We need to find a way to get the campaign going. So
through our meetings, some of our meetings, somebody came up with the Got Portal. How about shirts that say Got Portal?
a play on words from Got Milk.
Got Milk,
So
yeah.
Got Milk, Got Portal. It was simple.
And they were the very bright, obnoxious
Green.
lime green
Yes.
with black. But I'm telling you what, they got attention.
Yes. Yeah.
They got the attention. And we turned it into a contest for our employees as well as our patients. Yeah.
Yeah. So every Wednesday, all staff, we didn't make the providers. We had a few providers join in, but front, back, business office, everybody wore, including us, Wednesdays Got Portal shirts. So every Wednesday, we were green across the board, and it made people be like, what are you doing? We also made buttons. Our buttons, we have had those buttons historically, but our button said, ask me how to win $50.
Ah.
So the campaign for the patients was, if you send us a message from your portal, send it to us saying, enter me in the drawing, we will do a drawing. So we bribed our patients to email us. You'll be in a drawing for $50. And we did that for 3 months. So we had that patient winners. And then for this.
And real quick, the thought behind that was, if they can send us a message that says, enter me in the drawing, then they're going to get comfortable with sending us a message that says, I'm not feeling real great, not sure if I need to come in. So that was just get them on there. Get them used to sending a message. and then they'll see how easy it is to use.
Yeah.
That was the thought behind.
Well, just looking, this morning we had a chance to look at some of the statistics
Yes.
that you provided. Apparently, those methods worked extremely well.
Very well.
Extremely well.
Very well.
So congratulations on that really inventive thinking. That's just
Yeah.
fantastic.
It was fun, and for staff we had a contest. So we incentivized the front office, incentivized the back office with a separate gift
Contest, kind
yeah,
of,
and patients. So we hit it from the 3 angles, and then that made it very, very successful. I mean, our numbers went up immensely. Since then, you can see they've leveled off, but we do a trend over time, just a nice steady increase of use on our portal. So that was was definitely effective to get those numbers up. It was and it was fun.
And it's
Mostly.
kind of always trying to find out something new to do. Not that you should always have to have a contest, or not that you should, but you really have to keep the awareness out there
Yeah.
for the employees and providers as well as the patients.
Yes,
I mean,
yes.
it just has to be there. Like, we're kind of thinking already about what are we going to do for healow. Like, I want to do T-shirts that say, "Are you part of the movement?" Like, make it sound really dramatic, and I want them to say, "What movement? What are you
What are you
guys
guys-
doing?"
yeah.
Yeah.
Oh, well, let me
Yeah.
tell you about healow.
Yes.
You know, that type of thing.
Yes.
So.
Because we found, one of the interesting things, and when we looked at our statistics, we have family practice, and those generally we have a high Medicare population, the older crowd. And some of the docs, some of those fears they had were, well, my patients are old, they're not going to get on the web.
Right.
Yeah.
We found that people between 55 and just under 70 are our highest utilizers of the patient portal, which was unusual and surprising to us. We thought it would be the younger crowd, but they
Yeah.
don't. They don't use it. And I don't know if it's they don't have the time to sit around and think about their health care. They're not as sick as
They're
the
not as
older crowd.
engaged in their health care,
Generally,
probably.
they're
Yeah.
coming in once, twice a year. I'm sick or I need a well check. So they weren't very engaged. As we think about healow, we know that the smartphones, now my 70-year-old in-laws also use their smartphones, but the younger crowd, we have them with us all the time. That's a way for us to pull up a med list. It's a way for us to, look at a different office visit. So healow on our smartphones is going to be our next, like I said, our next big wave. It's the way to hit that younger crowd a bit more. So it was an interesting way to hit a different subset.
Along with Helo and along with the portal, you've also been using Messenger.
Yes.
Can you tell us a little bit about your experience with Messenger?
It's been going very well the last few months.
Yeah.
Just like anything else, there's your painful kind of like growing pains,
pains.
when you first start using it and trying to learn about it. And but really for the last 5 or 6 months, it's going
Yes.
very well. We use it for appointment reminders.
Yep.
Yeah. Steadily.
We transitioned from a different outside service a couple years ago. We didn't use it
For appointment reminders.
from the beginning for appointment reminders. It would crash our system when we would first use Messenger back in the day. We are self-hosted, and I don't know if that was part of the problem, but it would crash if I tried to send out 100 or 500 messages like it lets you do. Boom, it would crash Messenger and everything would freeze up. So we were nervous to turn on for the appointment reminders. But we finally did that a couple years ago.
Yeah.
And I think one of those statistics was we sent over 200,000 appointment reminders through
reminders.
Messenger. So
Yeah.
that was, that's a lot of messages. And we don't have that outside service. It was hard to let go of that
Right.
safety net for a minute.
Sure.
It was.
But I think pretty much seamless now. Only occasionally do we have issues with it, not sending the reminders out or sending them out a couple times.
Right.
Are you using various methodologies, various media, for lack of a better term? So you might emails,
Oh, yes.
text messages.
Yes.
Using
And
the whole.
when we first started, Janet could probably attest, there were some complaints about that. You sent me,
Yeah.
you told me 3 times, you kept sending me messages. And then we utilize the campaigns that are actually built into eClinical, the hard-coded campaigns for flu shot reminders every year. That helps us with our meaningful use numbers for the last quarter of notifications. We use it for the HPV notification. There are a lot of new ones that have come out, and the campaigns are much more robust than they used to be.
Yes.
You can edit them. You can change it. I wasn't comfortable sending out the HPV reminder to 13 to 19-year-olds with mom and dad getting the text saying, this is the number one sexually transmitted disease, HPV. So I took that part off. That's a nice thing. You used to be, you couldn't change your campaigns, but it's nice to change those. I didn't want the parent to see that and go, what, my kid's what? And that probably would have generated some complaints. So because you can customize them, they work in the background. I never have to think about them. It pulls the information, who had a HPV one or who needs an HPV one. So that's really nice. We've had our appointment reminders for the annuals on for years. That runs in the background. Been able to tweak that so we're not calling our Medicare patients that can't come in and get their physicals. We have a different program for that, as well as you guys now have a campaign for that. We aren't using it yet. We have our own, but it's, we see the progression of the campaigns, how we can use that with Messenger. So it's been very nice.
It's great. Really, this has been wonderful talking to you guys. You guys have really seemed to have nailed a lot of these patient engagement products, and really, you can see how helpful they've been both to the practice as well as to the patients. And certainly, the statistics that you guys have shown me are just phenomenal. Real success story, and it's great that you took the time to talk with us. I really, really appreciate it.
Thank you.
So again, thanks. From Carson City, Nevada, I'm Brian Saul, and if you're interested in watching more of the podcast, please check us out at my.eClinicalWorks.com. We're also available on YouTube and iTunes. Thank you for joining us today. I'm Brian Saul. Take care.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.